interest for global health started probably when I was a very young child. Just starting from even my origins, my parents were born in Nigeria, and so I always kind of grew up between American and Nigerian culture. And then to add more to that mix, my dad joined the Foreign Service when I was about 3 years old, and so we moved to Harare, Zimbabwe from Sayreville, New Jersey, which was very different. And so I think being in those spaces from there, being in South Africa, being in Ghana and Nigeria just as a child growing up, going to international schools and being around people who were very different from me, but also being in settings that were very different, very much accustomed me to kind of being in more of the world than just kind of where maybe my passport said. And so I think that made me think about problems that affected different people, but also think about what unified all of us. And I think our need for healthcare is one of those things that no matter what your skin color is or what language you speak, you generally need certain similar things. And so to me, healthcare was a way that I could bridge the gap a little bit and be able to learn a skill that would be transmit to different areas and different people, and that was exciting to me. And so I always knew that for me, healthcare was something that I was excited about in a global space. When I was looking at schools and thinking about my choices of different medical schools, global health was definitely on the top of my list. That was something that I looked at basically everywhere I went. I studied, my undergraduate degree was in nutrition at the public health school, the Global School of Global Public Health is really what they call it, at the University of North Carolina in Chapel Hill. And so kind of already having a background of learning about and doing education in a global-minded sense, I knew that I wanted to be somewhere else where I would be able to continue to learn that, but also build relationships and just get those experiences under my belt. You know, I'd been abroad for most of my life, but had never practiced as a provider or thought about medicine in that setting really as a provider, and so wanted to make sure I would have that hopefully, and so that is something I definitely looked for, and I thought that Penn had a really clear, strong program for the Center of Global Health. Seemed so incredible and impressive, and definitely something that I was looking for as soon as I came here. So the clinical rotation in Botswana is something that I heard a lot about. I remember, you know, when I was doing my research beforehand, hearing about the BUP program, the Botswana UPenn program, and knew that it was this entity that had existed a long time, didn't practically know exactly what that meant, but I was excited about it. And yeah, I guess really it looked very similar, but also very different from what doing a rotation at HUP would look like. So I remember my first day there, you know, going to the wards and trying to find what team I'm supposed to be on, which is exactly what happens on the first day at the wards of any team at HUP or at Penn or any of our hospitals here. And you find your team, and at first, you know, everyone was speaking Setswana around me. I didn't understand Setswana, still don't, you know, but just very much a new setting. But as soon as rounds started, I remember it being so familiar. I remember being understanding the flow. I knew what it meant to go from patient to patient. I knew what it meant for someone to present the patient, and then the attending or the residents to kind of give thoughts, then the attending to give thoughts, to think about how care would change. It was remarkable to me how similar everything was. And it shouldn't be surprising, but I think it really was a moment where I got to see that idea that I had actualized of really medicine does transcend borders, it really does. And so seeing how similar the hospital system was to ours, but also in a very, very different context. I mean, the conversations we had were different. The thoughts about medication and, you know, what testing was available and what kind of just considerations you had to have were very different. And I thought that that was really useful, and I'm really grateful for the opportunity to be able to just think creatively. I felt like we thought much more creatively about patients and had to have more flexibility, more resilience when thinking about their care. There wasn't, you know, I think it's wonderful to have a good algorithm that you can follow and, you know, want to obviously give the best care possible, but what happens when you can't do the algorithm? And I think that that was every day. That was every patient. It was definitely a journey every day. You didn't know what was gonna happen any day, but that's part of the fun. And so I think being at Princess Marina, being at in Mochudi at the regional hospital, that was also a really fascinating experience. Got to learn and see, again, how practice is different, but also very similar. It's the same problems, the same diagnoses. It's just, you know, what do we do and how do we make sure that that's context specific? So my other global health experience, I was in Rwanda working with an ophthalmologist who was the director of global education at the Rwanda International Institute of Ophthalmology. I had met him actually at a talk in Philadelphia. I believe that was in 2021. So it was my second year. I had slight interest in ophthalmology. I won't say that it was fully formed. And I didn't really go to the talk for ophthalmology. I think I meant more because it was a guy who had been overseas for a while, and just curious to hear what he would say. And so I thought, well, there's gonna be good free food, and maybe I'll, you know, talk to this guy. And I left that talk in tears. He really, just him sharing, not just about the work that he did, because I know about need to a degree, but I think that to hear his heart and how how he thought about the work that he did just really moved me. And I remember for the first time being like, I want to do what you're doing. And I think I had, gone through about a year of medical school at that point, learned amazing things, but hadn't really seen anyone who was doing really what I wanted to do. I think, again, it's like this idea I had in my head of working internationally, but not really knowing how that works in the healthcare field. And so getting to meet someone who did that was so moving to me. And so reached out to him, and he kind of started to mentor me throughout those early years. And then when the opportunity came around to do a scholarly pursuit, I knew I'd have time, found out that he'd landed in Rwanda for this new position and asked if I could come join him. And he was like, sure. And so, that's the first part of a very long conversation, but I think having mentor support is the biggest thing to start out with. And so he was that person for me, Dr. John Cropsey. And so that started those conversations, and then he connected me with more people at his institution just to make sure that everything was, going smoothly. And starting early was really important too, just because we, developed a project, but also needed to get IRB approval, and that took months, as it often does. So we did that, got IRB approval, got approval from the institute to make sure that I could be there. And then there was also this opportunity to present research, but also be a part of the annual meeting for ophthalmology in Central, Eastern, and Southern Africa. And so it's called the COEXA meeting. And so we ended up planning that I would kind of come at the start of that, be able to be there, present some research there, and then be in Rwanda for the next couple of weeks. I think being flexible, being open, asking questions, and sometimes just saying yes. Like, I remember him offering it, and I was like, sure. And he was like, would you want to give a podium talk? And in my mind, I was like, probably not, but I was like, sure. And I did, and it was awesome. Like, it was such a good experience. Even on the ground, I came in to do one project, but when I got there, it became clear that, one, I could do that project, but also there was lots of other data that was kind of just sitting around. And there was this kind of phenomenon where there's, wonderful physicians doing great work, but there's just not very many of them. And so the physicians doing great clinical work were just not able to really take the time necessary. They didn't have an academic day on Monday when they could be writing their papers or work through the data. And so in a lot of ways, I became privy to the fact that there's just not a lot of research that is at all representative of some of these populations. And a big part of that is because there aren't people who have the time to do it, who are there. And so in my mind, I was like, I'm here, I can't do clinical work. I'm not trained for that, but I can type, and I can make some tables, and I can gather data. And so I ended up working on about a total of 10 different projects during my few weeks there, and very grateful for the experience. So a thing that I would tell other students who are interested in global health would be that an exercise that can be very helpful when abroad, especially in places that maybe have lower resource or just kind of different resource allocation than we have here, is really to do the exercise of thinking about what's being done really well here. And this is something that I was able to adopt when I was in Botswana, because it's so easy to be like, oh, that's different, or there's not enough of this, and there's not enough of this, and there's this scarcity or this thing that can be kind of easy to do. But what about what is done here better than what we do in the US? I think that just reframing and doing that mental work, and I actually every day I would try to think of one thing that I saw or observed that I thought was better than what I would see at home, and I would write it in my little journal. And so I think just taking that time to think, and because also that's what you're going to take home, and that's what you can do differently. And so I think as much as we get to be in these spaces for short amounts of time, you're likely not going to change the Botswana health system in 6 weeks. It's probably not your role. But you can change how you practice as a physician for the rest of your life. And so I think really taking this as an opportunity to learn, and even having the respect and awareness that there is something for you to learn from this place. It's not just for you to teach or to demonstrate a new way, that there's something for you to take from that too, I think allows you to enjoy the time and really be more enriched, but then also probably change your care and change the way that you'll treat patients. And that's really important. Ultimately, that's what we're here to do, is learn how to be good doctors. And so I think that being in global health spaces really does give you a unique vantage point and opportunity to learn niche things and unique things that can help you be a really good doctor.